As the end of life draws near, will your family and medical team know the treatment you want or don't want? How can you make sure that your own values and intentions are in control right to the end? For Georgians, a process known as Advanced Care Planning provides the answer. It is the way to spell out end-of-life health care wishes. In the big picture of putting all of our affairs in order, Advanced Care Planning is one of the most important pieces.
We as a medical profession need to understand what your wishes are. And your wishes are controlled by your values, by your culture, by your life experiences. And only you really has the right to tell me, the physician, what it is that is important to you should you be in an end-of-life situation.
Advanced Care Planning has two parts. One is a legal document called an Advanced Directive that covers a number of scenarios in which a person might be terminally ill or unable to regain consciousness. The Advanced Directive expresses your treatment wishes in all of those circumstances.
Wishes about how do you want to handle a situation if your heart stops. Situations where do you want to be intubated? Do you want a feeding tube? So there are a whole series of questions that are potentially there that will help to give direction under certain situations.
The other part of Advanced Care Planning is the naming of a health care agent, usually a family member or trusted friend, who will make treatment decisions for you if you cannot.
That may be your husband or wife. It could be a child, or it could be your best friend. But it's important that somebody be appointed because Advanced Directives will provide us with most of the information we need. But in some instances, there may be nuances or gray areas, and we will need somebody who can speak for you.
Advanced Care Planning has been described as a gift to your family. It spares loved ones the burden and sometimes the conflict of making hard choices at a time of emotional distress.
This family was really struggling on what to do. There was nothing in writing. There was no advance directive. And so there was, one family member's going, well, we need to do this for Mama. And one family member saying, but I don't think Mama would want that. And so it can be very difficult for the families as they're all trying to cope with what's happened to their mother, and then they're being also asked to make very, very difficult decisions. I think most people have thought about what they want to do or what they don't want to have done, but it's not always communicated.
In the best of worlds, every adult would think through and declare their wishes in an advance directive and share it with doctors and family members, but many do not.
I would say, honestly, about 50-50. Sometimes you walk in and it's already in the computer on the chart. Oftentimes you might find that there's none, but they actually do have an idea of what they might want. And so we're able to get that conversation going, or have them do the advanced directives while they're at the facility, at the hospital.
The ideal situation is that in a calm setting, at home, with your family, you make decisions. And those decisions are then expressed in your advance directive.
Sometimes these conversations are put off because of discomfort with the subject, but wise families take the time to talk it out.
We've been very frank and open with both of our children about my illness. It's made it easier, I think, for us to be able to talk and to feel like the kids are involved in the ups and downs of what's happening.
When people speak really honestly about something that is really important like this, it really brings a family closer together. It brings two people closer together. It doesn't separate them as they fear it will.
Following complicated end-of-life experiences with both of her parents, Darla Vetter realized the importance of communicating frankly with her doctor.
And I said to him, when the cancer came back, I said, here's what I want. I figure we're going to have to go through fire. And I don't want to go through it by myself. I want you standing right beside me, holding my hand in that fire.
The role of physicians and nurses and family is to honor and to assure that your wishes are carried out as to how you choose to have your care provided at the end of your life.
End-of-life decisions most often are made later in life or when a chronic disease is involved, but the issue can arise at any age or stage of life.
I was healthy. My pregnancy was healthy at that point. I had gotten up in the middle of the night to get a glass of water, and I felt a lump on my chest.
Suddenly you feel one mass in a CAT scan later, and now here we were walking into the chemo center at Wellstar, and I could tell everyone was hoping the needle was going to go into my arm. And when they put it into my wife's arm, the pregnant lady, the whole room gasped.
It was just a really, really hard time for us. You already have one healthy child. You're so excited about having another one, and then this happens. It does change your life forever. You really appreciate life. You really take things into perspective.
After her cancer, we made an advanced directive, even though we were so young, and we have a power of attorney, and we have it spelled out what our wishes are, and how we want things to be dealt with in the event of something, bad happening. And I think it's a smart way to go.
I just celebrated my 5-year mark in end of March, and he just turned 5 May 3rd. He's wonderful. He's, knock on wood, has had no health issues. He's growing. He doesn't even know, or understand quite yet what he's actually gone through.
I think it's made our family a lot closer and stronger. We were close before, but and now I know what everyone wants. I know what everyone wants, and that's going to be, that could potentially be real important down the road.
People often ask what type of medical events trigger the advanced directive to go into effect.
It doesn't become active until it's clear that you are either at the end of your life or you are going to be permanently unconscious and not able to really lead an active life.
What if you want to change your mind about the type of treatment you want?
An advanced directive is a document that can be edited, changed, canceled, start over at any particular time.
So how to get started with your own advanced care planning? There are several ways. Your doctor or hospital can provide information, resources, and forms. Many attorneys include this service as part of estate planning. More and more Georgians are using the Critical Conditions Planning Guide, a user-friendly workbook published by the nonprofit group Georgia Health Decisions. Step by step, this planning guide helps you think through your decisions and state them clearly. It also explains how to have it witnessed and who needs to be informed to make sure that all the relevant parties understand what you want.
It eases the burden of the families to have to make that decision during an emotional crisis. It really does help them to have all that information at hand and just proceed with either the curative factor or the comfort care factor, whichever the patient has desired.
Without an advanced directive, others could make your most important end-of-life decisions. With an advanced directive, you have the final word.
The end will come to everyone, and we don't always know when it is and what's going to cause it, but that we need to be prepared and to know what to do, that we all live our lives wanting to be in control, and you don't want the final phase of it to be totally beyond your control, and that there are ways to think about it.
Our final gift to those we love can be clarity and certainty. To learn more, visit the Critical Conditions website. If you would like more information on personal estate planning, please contact Wellstar Foundation at 770-956-6670 or wellstar.org/giving.